Good morning and welcome to those of you who have joined us. We will get started in just a couple minutes. We want to give people time to join the meeting. Has our recording been started?
Just started it and it's working on YouTube Live as well.
Excellent, thank you. Again, good morning and welcome. For those of you who have joined us, we're going to give another minute to allow people to join the meeting and then we'll get started. Again, good morning and thank you for those of you who are joining our 9th Waiver Reimagine Advisory Committee meeting. My name is Leah. I'm a middle-aged white woman sitting in a home office with short brown hair and glasses. Very happy to have you with us today. Thank you for making time to join us. For those who celebrate, I'd like to recognize today is Eid al-Adha. So celebrations to those who celebrate. And let's go on to our next slide. I guess we can go one more. Thank you. Here's today's agenda. We're going to review our meeting practices so everybody who's joining understands how to have a smooth meeting. We're going to recap April's meeting for everybody here and then discuss today's meeting objectives. We'll have a quick recap of rates and budgets. And then today's focus is on budget exceptions. So we will have an overview of that and then review the feedback that so many of you provided. Thank you very much for doing that in the pre-work. And then we'll allot the bulk of today's discussion for talking more about budget exceptions. And that time does include time for questions. So if you have some along the way, please write those down so we can be sure to get to them during that time. And then as ever, we'll wrap up and talk about our next meeting and our future meeting strategy. So next slide, please. This is a review for those of us who've been meeting, but for everybody present, I'm not going to read all of these, but these are our meeting practices that we follow to have a respectful and smooth meeting. So if you do share with the group, could you please reintroduce yourself and who you represent? We do have live captions today. The link has been placed in the chat, and we ask that people be mindful to speak slowly so the captioner can capture what we're saying. Share your main thoughts and key points early so that we can allow everybody to share. Let's go to the next slide. Be respectful of the process and other participants, including privacy, so avoid sharing names or things that might invade somebody's privacy. Listen with an open mind. We like to assume positive intent, embracing a mindset that will lead to something good. And summarize what you've heard to ensure understanding before reacting to someone else's comments. And next slide, please. Here again is the link for live captions, which has also been put in the chat again. And we do want to pause to remind people of our chat guidance. We want to be mindful that chat can actually be distracting both to the presenters and to other participants. So use chat as you would if you were in an in-person meeting. And if you would turn to your neighbor in an in-person meeting and say something out loud, then go ahead and use the chat for that. If you wouldn't, save it for when it's time to be called on and recognized. We have learned that people who use screen readers have every word of chat read to them. So if that is happening during a presentation and people are having side conversations, it can be very distracting for those using screen readers. So thank you for being mindful of using chat. I think we can go to the next slide. And Matt, I believe it's over to you.
Just getting things started here. Hi, my name is Matt Knudsen. I'm the supervisor of the waiver policy and compliance team. I use male series pronouns. I'm a middle-aged white man with a big gray beard sitting in a basement office. And I want to give you an update of the April meeting. So the policy topic for the April Waiver Reimagine Advisory Committee meeting was services in a two-waiver system. And it was really a continuation from our December Waiver Reimagine Advisory Committee meeting. During the meeting, DHS staff described 12 waiver services. So we gave an overview of each of the services, each of the 12. And then advisory committee members asked questions and discussed and developed recommendations for which waiver service or which waiver, which of two waivers, potential waivers, each of the 12 services should be available under. And as you recall, waiver 1 is for people who live in their own home or family home, and waiver 2 for people live in provider managed residential settings. The majority of members recommended that services be available on both waivers with some unique carve-outs. So we'll work at looking at what's opportunities there are to provide services across both waivers. And the April 26th presentation and a summary of the feedback was sent to members after the meeting and also posted to the Waiver Reimagine Advisory Committee website. At the April meeting, it was also noted that service mix information resulted in some confusion at the February meeting. Plans are to revisit the topic at the June meeting, We're going to revisit it at this meeting. However, due to time and the need for focus on budget exception development at this meeting, service mixes will be reviewed at another point in the future. So we'll look at that again. I appreciate the time and appreciate everybody participating in this, and I'm going to hand it over to Mei Ling now. Thanks.
Hi, good morning, everyone. My name's Mei Ling Moy. I'm the newest addition to the program integrity team, and I'm super excited to work with everyone in making Waiver Reimagine a success. So let's go over the meeting objectives. For RAC members, we will go over rates and budgets. Please provide your feedback on the future budget exception implementation. The DHS staff will provide understandable explanation of rates, budgets, and budget exception development. They will listen and note feedback responses. They will answer questions and note any follow-up. Next slide, please. In today's meeting, we will be gathering information with RAC members for the exception development work. RAC members will be going over the work of DHS and other stakeholder groups to help in creating future budget exceptions. The discussion today will focus on the results from the pre-meeting survey and gather further group input on additional budget exception types proposed by members, developing clarity and unclear budget exception, and revisiting outstanding questions or comments. At the end of the meeting, we will not have a final budget exception process, but we will have a list of solid budget exception types. And then next up, we'll have Megan start us off with the next slide, please.
Thank you very much, Mei Ling. Hi, everybody. My name is Megan Lindblom. I'm the Program Integrity Supervisor. Our team oversees the budget implementation portions of Waiver Reimagine. I use the female series of pronouns. I am a white woman with her red hair pile atop her head today and a blue sweater in my attic office. And let's go to the next slide. In our after meeting evaluation from the last time we talked about budgets, which was the February meeting, feels like a very long time ago and many, many degrees ago, we had some members express kind of not understanding the difference between rates and budgets. So we wanted to hold a little bit of space at the beginning of our meeting before we jump into our budget exception discussions to talk a little bit about that and see if there's other questions that people have or things that we can clarify. So if we could go to the next slide, please, that would be really helpful. So this is just a little visual, and we've included this on recent materials as well, so I don't want to really belabor the point. But when we talk about rates and budgets, those things kind of smash into each other, and it's hard to understand, especially if you're someone who doesn't deal with this world all the time. So a service rate is the cost of the service being provided, right? If I am using IHS with training, the cost of that service would be called a rate. And a budget is how much a person has available to spend on their service. So sometimes with these things, analogies are helpful. In our share, we live in the generally same area. So using kind of the thought of a store, rates for services are like the cost of an item. How much is it for a pound of beef or an apple or that really delicious sugary cereal that we're probably not supposed to eat, but yet we still do? And then a budget is how much we would have to spend on those items. How many apples can I buy? How many pounds of beef? Or if you're like me, how many bags of cereal can I buy? Because that's how you stretch your dollar, right? So that's really kind of thinking through those two things. Also, we provided a visual on the right side of the slide, looking at kind of those little hexagons. It says service rate number 1, service rate number 2, right? Those different costs of items, our cereal, our apples, or our beef. And then the purple octagon on the outside, right? That bigger octagon is really there to kind of paint a fence, right? Paint those limitations around how much we could actually purchase of those services. So with that, I want to pause for a moment and open up to all members and say, do you have things that you find confusing? Do you have maybe things that you've heard in your conversations in your community or places you think we could help further clarify on what a rate or a budget is or kind of anything in that space? So we're going to hold about 10 minutes of time. Just to make sure that we're all on the same page. I would invite anyone to, oh, go ahead, Leah, sorry.
I was just going to say, so if anybody does have a question or a comment, you can raise your hand. Or if you are unable to do that, you could put it in the chat. Trisha, do you have a question?
I do, thank you. So what I hear you saying is that service rates are basically the cost of the service and the budget is how much money you have to pay for that service. Can you tell me, I think it would be helpful to understand who's in charge of setting the rate and who's in charge of setting a budget. I could go further into it, but I think just even that delineation would be helpful in understanding the difference. Thank you.
Yeah, for sure. Not a problem. So there's kind of a couple pieces to that answer, and I'm going to start with the rates. The majority of the rates on the waivers as they are today and the waivers in the future are under what we call the disability waiver rates system. It's about 80% of all spending. And those are rate formulas that I know in February, we had some of our coworkers from DHS come and talk about that. Colin Stumper provided a little bit more background on that. What those are and how we set rates generally has to do with the statutory language that guides us to how we have to set the rates. So there is a couple of layers. The legislature approved those rates and the methodology used to do that. And that's for all rates, whether it's a DWS rate or not. Maybe we have something, if you're aware of something like a state plan rate or just a static rate. And then we also have to move those through in that methodology through approval through CMS as well. So it is the state approved by the federal government that is establishing those rates. There are teams throughout DSD that also do a lot of research and evaluation on the rates. We also have something called a market rate. That is something that is a variable and it's set by the county. On the budgeting side, that is also something that has a similar approval process where the legislature is helping set the amounts of those budgets. We obviously are here having conversations around what that budget would be and what methodology would use to be approved by the legislature, right? That's what we've been talking about now for quite some time. And then also we have to get approval from the federal government. Kind of a way to tie these together that we'll talk about too in the next slide is with the individual budget methodology that we've been talking about. The rates are kind of the driver of how much the budget is, right? We look at and build on the rates themselves. Does that answer your question, Tricia?
I find it helpful. Thank you.
Sure, not a problem.
We've got Lisa and then Rosalie, and then there is a comment in chat as well. So Lisa, do you want to go ahead and ask your question?
Yeah, well, just my observation, I think in a simplistic sense, a rate versus a budget totally makes sense. You've done a great job, in my opinion. As we've weaved through our time with RAC, where I want to continue to keep understanding, and it's not crystal clear, but you've got rates and budget, traditional waiver, rates, budget, CDCS, and then within CDCS, we've talked in the past about inside the budget, outside the budget. That's where I start to lose clarity. And I don't even know, would it be fair to say we all have not figured that exactly out? Would that be fair to say as we sit today?
So what services are inside and outside of the budget limitation is something where we have proposals, but because of the variables we have, like having to reset or recalibrate the budget that we've talked about in recent meetings as well. You're correct. It's not set in stone yet. We have some more room. And I think that would be something we'd want to put on our to-do list from the DHS side of like, let's have a further conversation about that as well. What really needs to be inside and outside of the budget. Not everything can be outside of the budget. But we want to make sure that we're really being able to balance the important to a person and important for a person, and as well as kind of how we will see a lot of variation in spending as well. So thank you, that's true. And I appreciate you saying that this is clear, but as soon as we add in more complexity, it does get very muddly very quickly. It's why there's so many of us that work on this.
Right, all right, okay. I just wanted to throw that in there, that it's kind of like we start to see it filter down and there's still some gray area for discussion. So, all right, thank you.
Then we've got Rosalie and next is Kelly. Oh, was somebody trying to speak there?
I apologize that I'm butting in. I was just trying to find that slide in my packet and I don't see the number on the
Slide 12.
Okay, thank you very much. I apologize again. Go ahead.
That's okay. That's fine. So Rosalie has their hand up and then Kelly.
Hi, this is Rosalie Eisenreich from Semsil. I have a couple questions. So I understand the difference between like just the generic service rate versus the overall budget, but I'm wondering, Megan, if you could explain or clarify a bit further how, you know, there are different types of rates. My understanding is there is the DWRS, the rate framework, but there are services outside of that rate framework currently. Could you speak more to that a little bit, just so that everyone has, I want to make sure that I am following correctly, but also I think, you know, others might have the same question. And then the second piece is, and this might get to, you know, I keep on asking this question of, well, how do things get processed? Like, how does federal government process each individual budget? Like, what are the factors that go into that? And I know that might scrapes into service mix, but like what are those things? Like how is that evaluation process go? So when you like start out and like each question in the min choices assessment, like how do you get from asking all those questions and then how is that all calculated? And like then you get that end product. Like that's my big question is like, what is that process? Because that's going to change with this like leveling. And so I'm just curious, like what is the current process and how is that potentially going to change? That might be a question for a later day, but that's the big question I think all of us are trying to figure out, because that then answers and provides the math, provides the transparency to, like, we hear you saying 89% of all budgets are not going to change, but like we don't see it because the numbers currently on the 2021 legislative report, like the numbers don't add up. So like that question, I feel like will answer a lot of the questions around and the concerns around the budgets changing.
For sure. So I'm going to give you a really quick answer to that second one, and then we can talk about the types of rates, right? And you and I have talked about this a couple of times now, and we've provided this in a number of ways. Everything, how all of this has been laid out, we've talked about in a couple of different meetings now, what the methodology is and how we've proposed it. And there's a lot of really great resources online, the Waiver Reimagine website, on the resources tab that walk through how every one of these decisions has been made. When we talk about the federal approval, really what they're going to be doing, first we had to get that state approval for the methodology, which we did in, I think, 21. I'm sorry, my years are absolutely blending together. And the legislature said, yes, move forward and start to implement this. And as we move forward with our new waiver plans, part of that will be the budget methodology. And that's where that approval comes from CDC or from CMS. Sorry, so many C starts there on our acronyms. But so what we'll see here is we really at the state with you all and the legislature are the ones that are developing this, and then it has to be approved by the feds. When we talk about what the math is, every single step of this has been documented in reports. If you want to know which questions and min choices are scored, that is in the reports. If you want to know how each one of these service mix decisions are made, that is also in the reports. I know the numbers from the 2021 legislative report, which is kind of the big overall summary, do not match out to today's spending. But I will just put in the pause and again, remind us that we have recalibration coming in the coming years, which looks at, does the new min choices assessment align with our methodology, or where do we need to change that? As well as looking at our service mixes, both for change in the services, in utilization, and the rates. So overall, all of that math has been provided a number of times. It is all there in the materials posted online for transparency. And if there's any follow-up questions to really dig into any one of those options, I would really appreciate if anyone wants to email the Waiver Reimagine inbox, they can do so and we can dig in a little bit more. But all of that, we've been really trying to value transparency and make sure every one of those steps is posted and has been posted online now for a number of years. To switch over, talk about the rates. I am not a rate expert. I dabbled in it in my past life, so I can talk about it a little bit, but we can always bring our rate experts back into. Really, there's 3 lanes of rate types. So there's DWS that we talked about. It's a framework, it's a calculated rate. And when we say calculated, it means that there's kind of this math problem, and we drop in the variables that pertain to that individual, and it calculates out a rate. There is also what is called a state set rate. That is just a blanket, this is how much that rate is. There's a number of different ways those are calculated based on history and new information, or tying it up to an index. So that gets really complex really fast. And then there's also the market rate that I talked about. And though there's some rates that just see variability a lot, or maybe very different in different areas of the state. So that's something that is set by the county in the planning process, right? So there's a few different services that are called a market rate as well. When we talk about the share of spending or the share of services, DWS does still account for about 80% of all spending on these waivers. So the majority of rates that you're going to interact with are calculated rates. But I know we have other questions and we're already getting close on time there. So let's keep it moving. Leah, who is next?
We've got Kelly, and then there's a chat from Gina. I was going to ask if you have time to take those.
Sure, let's do it really quick. Kelly, can you?
Yes, just two quick things. I was trying to actually answer my own question, so I'm looking at the Waiver Reimagine committee site to look at the past meeting minutes. And there are, I can link onto the agenda and the presentation, but the meeting minutes are not linkable. So just wondering where would I go to find meeting minutes from last meeting, just to review quick. One question, and then second, as we're going along, things are already being approved. And as we talk about today's topic, they're going to have to be approved through the legislator. So wondering again, if you can remind me, this was the question I was trying to answer myself, remind me exactly which legislative committee is helping make these approvals, and are we able to get dates and times and locations of when these things are going to be presented to the legislation? So in case we'd like to come and just be a part and hear that, we could just be there to just listen in. Is that an option?
For sure. And I know you and I have also talked about this one, so we'll revisit it real quick and keep us moving. As far as the meeting minutes, which month were you looking at? We'll take a look and see if that link didn't just get broken.
Just looking at April. Yeah, I just wanted to go back in case the information was there. But again, the agenda and presentation I can click on, but not the meeting summary or the chat transcript.
Thank you. We'll take a look at that and see if maybe that's something on our end. A lot of these, the things that I was just referencing to answer Rosalie's question are going to be either in the February or the October meeting minutes. So go ahead and take a look there if we wanted to talk about rates or the recalibration process. As far as the legislature, as it stands today, we have approval for implementation. As there's changes or larger changes, we will revisit that with the legislature. But that's not something I think we would anticipate occurring until probably 25 at this point. So overall, I can't say, hey, on January 10th, 2024, we're going to be talking about Waiver Reimagine, but we can for sure try our best to notify you when Waiver Reimagine is on the schedule for any one of the legislative hearings. The legislature sets their own timetables, their own agendas, so that's not something that we control at all, and nor will we really even have that much of an advance notice. So we can for sure try to keep an eye on that and let RAC members know to come and be part of that conversation. It is the Human Services overall committees, though it may pop up in a number of them. So you're really looking for Human Services committees at any time. That's typically what they're called. Though again, the legislature sets their own agenda and they also set their own committees. So if they choose to change those, that will be something they can do.
Okay, so then just to clarify, DHS already has approval to just implement these changes. So data that we give you or suggestions we give you, hopefully we will be seen as part of the implemented changes, because there's no legislator that needs to approve them. We've already got approval to do it.
We have approval to do the implementation. If there's major changes, that's when we get into needing to go back to the legislature. So like, let's say the outcome of our conversations is that everyone needs to have twice as much budget as they have today. We don't have authority to spend more than what we're already spending. So we would go back to the legislature and say, hey, we need twice as much money. And then there would be a lot of hearings there. And that's a really, like a really broad way to say that. I don't think we'd be proposing to double our budgets, but it's an easy way to explain it. To keep us on track though, I do want to keep us moving. So I'm going to jump into Gina's question here. For those of you, if you can't see it, the question is, as a side question, rates are negotiated all the time. How often are the budgets reevaluated and reset on a state level? This is something that we've talked about a number of times as well. So I would say, hey, let's revisit some of our notes from October and February specifically. The budgets are tied out to the rates that are included in the service mix, which is a good fair amount of them. So if our rate changes, our rate updates, because we do have built-in increases and changes in the DWS rate frameworks, the budget would change in lockstep. So if you were able to purchase 10 apples and the price of apples goes up, right? Just using our analogy here again, the budget should be expanding to make sure that you still have that same purchasing power for 10 apples. We are always reevaluating our budget methodologies. That's something we're building right now, looking at how are we making sure that we're aligned overall. So that'll also be part of a future conversation, but we anticipate always looking and saying like, okay, are we seeing a really big growth in budget exceptions? Are we seeing Some people really having a hard time as their population that we can maybe focus on and make sure that our budget methodology is included. So there's a lot of analysis on the back end. However, the rates are built to move and change, and the budgets are built on top of them. And that is why. So we aren't ever having an unfunded change in someone's ability to spend. With that, I think we need to keep moving on. So can we go to the next slide? And this is just a really quick recap. Why do we keep talking about this? Some of you may be on back and be like, lady, we have talked about this 3 meetings in a row. Why do you keep bringing this up? We've got it, right? And it is because of what I just said. Our budgets are built on our rates. So understanding both the difference and how those things connect is really important. If we want to understand how much a budget is, we got to understand where the rates are coming from as well, and how we calculate all those things, which is the big part of what we talked about in February, which is the service mixes. So again, if you wanted to go back onto the website, look at the meeting minutes, the presentation, any of that, and you still have questions, send us an email and we will do our best to get you a very clear and concise answer. But with that, I think I'm handing it off to Sandy on the next slide.
I'm back. Sorry, finicky camera. So good morning. I'm Sandy Zolsdorf, and I use she and her pronouns. I'm a middle-aged white woman with shoulder-length brown hair, wearing a sleeveless black shirt, and I'm sitting in my home office, which is a 4-season porch. I'm also part of the program integrity team, and my position is primarily to support the implementation of individual budgets for Waiver Reimagine. I have also been assisting with the development of the future budget exceptions that we are discussing today. Could you go to the next slide, please? As noted in the agenda, we have allotted a great portion of this meeting for discussion with the RAC members about their thoughts and ideas for future budget exception criteria. Before we move into that work, I wanted to review what is necessary to create the policy for the development of budget exceptions. We also want members to understand what is needed from them in the process at this time, what is important to know about budget exceptions, and share additional details about the proposed budget exception types that have been thought about so far. In our upcoming discussions, we're going to talk about additional budget exception types proposed by members through the pre-work survey, clarification of budget exceptions that some members have asked about, and revisit any outstanding questions or comments. Next slide, please. So in working to develop a budget exception criteria, it's important to understand specifically what we are talking about. An exception is necessary when an individual has a situation to which a rule does not apply. The exceptions process acknowledges that one rule does not meet the needs of all individuals. Past data has shown that changing over to a two-waiver system using individual budgets, 89% of the people will be able to meet their needs within those proposed budgets. And I know Megan just elaborated on some of that. We also know that roughly 11% will not have budgets that are equal to their current spending. However, we do not anticipate that all 11% who are currently over their anticipated budgets will need a budget exception. And this is primarily because in future service planning, individuals will select from a service menu to potentially access non-waiver funded services in combination with those waiver funded services to meet their needs within the budget. I don't remember who mentioned that, but you know, that was when we were talking about those in and out of budget services that have to be further defined. Next slide, please. As we continue working towards Waiver Reimagine implementation, there needs to be thoughtful planning of the impact to all potential areas for individuals receiving services. Today, we want to hear your perspectives about the reasons people may need a budget exception, and we are looking for you to help in finding the gaps in the process of the potential policy development. Next slide, please. Development of budget exceptions have been underway since 2019, and the conversation today is going to build off of layers of feedback and research that have been done to date. Next slide, please. Today, we are looking to you as the experts to help in the continuation of the work in developing these future budget exceptions. When we talk about previous research that has been done, we are referring to national research on the exceptions, such as looking at other state systems. And I do want to take a moment and note that Rosalie did reach out to ask for more specific information about this. And we're looking at to see what notations there might be about the national research that could be sent out. So someone does plan to be in touch with you to follow up on that after this. Other previous work that was included in this is multiple lead agency work groups. There was broad stakeholder and community member feedback, including past inputs from within the RAC meetings and other conversations with members along the way. So things that you guys have said in previous meetings or conversations one-on-one that have been noted to pay attention to in regard to this topic. Additionally, there was also internal development of exceptions based on review of real cases for people over budget, and there was collaboration with other exceptions policy staff at DHS. Next slide, please. As I just mentioned, there's a process in the work, and because of that, we need to break it down into stages of development. These are the core questions for developing the budget exception criteria that will need to be completed before the official policies can be drafted. So we're looking at who is eligible for an exception, what type of exception or exceptions do they need, how much of the exception or exceptions do they need, and what is the process to request, review, approve, deny, and renew the exceptions. And although it's important for everyone to know all of this information, today our focus is going to be on determining the who and the what is needed for exception development. Next slide, please. To help in the upcoming discussion, we provided an example exception for better understanding. This is an example of an age-based transition. It was originally proposed by a lead agency staff that saw the need to support people into adulthood when their budget did not meet their temporary needs, or when a person was transitioning from an out-of-home placement as a child. There's a table on this PowerPoint page that shows the policy questions that I just mentioned in the previous slide. That these would be the things that need to be answered for the proposed exception. In developing this, we'll start with the who is eligible for the exception. In this example, the proposed answer is people 18 to 25 years of age that are transitioning into adulthood. Then we look at what type of exception do they need. And the proposed answer is possibly 1 to 2 years of additional funding to support the establishment of their adult life services. As you look at the chart, you'll see the answer to how much of the exception do they need and other policy related questions regarding the process, approval, denial, renewal, all have to be revisited in the future. Those factors can't be decided until we have concrete reasons established for the budget exceptions to build off of, and that includes any changes we decide to make about the example I just shared today. Next slide, please. First, I want to give another big thank you to those that completed the pre-work survey. There was 22 overall that participated and provided very thoughtful comments. And in reading those results, we saw a number of the responses were focused on the process for getting a budget exception. And as I just mentioned, that part isn't going to be developed today, but we did want to share some of the examples of those questions in this slide for reference. Since the focus of that portion of the meeting does not address those, we wanted to make notation and have them set aside when we get to that stage of development in our budget exceptions. So you can read through those on your own time, but just to give you a reference of some of the things that we need to look at further down the road. Next slide, please. So to restate and be clear, we are not going to have the exceptions fully developed at the end of this meeting. We have a lot of work to do on just developing the core criteria. And as I said before, there's stages of the development process. As we proceed in our work, it's important to remember that our final goal for exceptions process should result in in the following. We need clear criteria so case managers can use their professional judgment to detail their approval or denial of an exception that may not fit into defined categories. We also need streamlined and integrated forms within the current process wherever possible, and consistency in process across all lead agencies, as well as determining verification information needed for initial and renewals. Next slide, please. As I'm sure you've gathered by now, budget exception development is complex work. There's no one reason a person may spend on services, more on services than in their future budget. This makes creating exceptions that much harder. And the main reasons we're going to focus on today are individuals using higher cost of services, using more services than assumed, as well as a combination of other factors. Next, Megan's going to talk more about the proposed budget exceptions, the survey feedback, and we're going to have our discussion time. Thank you.
Thank you very much, Sandy. And just to reintroduce myself, hi, I'm Megan Lindblom, Program Integrity Supervisor. And I'm back for a little bit to get us started and lay some more foundational work. I think what Sandy just really laid out here for us, which was helpful, is that this is a really complex process. And I think we all come from different perspectives and different places in the conversation. So as we talk today, I think it's really important for us to remember that. And also remember, we're not tackling the whole thing today, just part of it that helps us move on to the next step. So next slide, please. So in the next two slides, I'm really going to go over each one of these in detail. These are the proposed budget exceptions criteria that we sent out first in the the brief with the survey that you all did so well filling out. Thank you again. I don't think we're ever going to stop saying thank you because it was just one of the most helpful things that we could do and get from you all. But we've also included that in other materials. I think it should be in your discussion guide as well. If you have that handy, this is really the time to pull it out. We are about to hit our discussion points. But I am going to go through each one of these again to make sure that we're all on the same page. That first proposed budget exception would be a high or above average health or behavioral needs. And there's two parts to this one. One for people requiring 1-to-1 or 2-to-1 staffing levels who are served in a provider controlled setting. Sometimes we refer to that as a residential setting, so a little bit broader than that. Or people who are requiring 2-to-1 staffing in an individual setting. And I know we received some questions like, well, what is high or above average health or behavioral need? As DHS sees it, this would be someone who has MnChoice's assessed support needs for high or health or behavioral, which from the budgeting perspective puts those support ranges at L, H, and E. Again, really wanting to make sure that we have a clear tie out to someone's need when a budget exception is being requested. So that would be something we would see reflected in a MnChoice's assessment. And so if someone was coming and saying, hey, I have health, I have above average health needs, I need these supports, and that's why I need this budget exception, and it wasn't collected in the MnChoice's assessment, that might be a point of conversation. But again, future pieces. The next item is safety net. And this would be for people whose current supports and services need to be maintained with a required higher level of care to ensure stability or protection for the person or the community. And it may or may not be tied to a previous higher support need. And I know we got some questions, and part of our discussion today will center around this one, saying, you'd be like, oh, what does this really mean? And I think we're looking for more clarity from you all. What does safety net mean? We're just part of the puzzle here. You guys have a lot more insight and understanding about what this might look like, or when a person may need a safety net and what that could look like for them. The next one we have is the 24-hour staffing. This is for people with an established need of higher staffing in an individual setting, not in a provider controlled setting, to maintain their health and safety. This is someone who may have needs that are high enough that they need that 1-to-1 staffing 24 hours a day, even if they're living independently. A high need setting is for people whose needs haven't been adequately supported at the customary staffing levels So what this could also mean is a person hasn't found a residence with the adequate support or trained staff. They may be sitting in maybe a residential or provider controlled setting that is for people with higher needs. And so we need to make sure that they're getting the services they need while they transition to the appropriate amount of care. Next slide, please. The next item that I have there is emergency need. And that's really when an emergency arises, right? This could be someone for someone who has experienced death or sudden loss of a caregiver, a temporary emergent relocation, or another event causing significant increase in cost of services. So one thing we hear about and see and experience every spring is some people live in floodplains here in the state of Minnesota, and on a very wet spring, they may need to move out of the way of flooding. That can cause a really quick spike in the need for services and spendings. We may need to have some sort of emergency place for that budget exception to go that allows that care to continue, even though where they may be living or where they're getting services has been disrupted. The next one we have is an age-based transition. This is really looking at that transition into adulthood for people. They may be transitioning out of a parental home, maybe out of the youth foster care system, shelter, or any similar setting into a more independent or adult setting. This is really acknowledging that in our society, we have, what do we call them? I think the boomerang kids who may go to college, or they may move out and then come back, or kids in that time period or young adults really do need extra supports to establish themselves in the adult sphere. Next one is the temporary transition, and this would be for people transitioning out of residential, provider controlled, hospital, or other institutional setting into an individual setting. Just acknowledging that during that transition period, there may be additional supports that they need to, again, establish how they can live independently and be successful. And last but absolutely not least, employment utilization. This is maybe something a little bit offsides of everything else we talked about, which is that need-based, but moving towards the goal we have of employment for all, which would be allowing for more units of service than anticipated to reach full community-based employment goals. So that is all of them, and I'm going to keep us moving. But like I said, we've sent this in multiple formats. So if you've got that paper handy, you've got another screen to look at that, it would really be helpful as we have our discussions to have that. And that is why we provided that. One of the reasons we provided our discussion guide. We can go to the next slide, please. Okay, so we've referenced it a number of times and thanked you. And I just want to again say thank you for the amazing amount of responses and thoughtful, really diving in responses that we got from such a short survey. So we did send out a survey. I think, again, my years are all getting muddled. I think this was in the end of May, early June, and asked all members to reply. And we did get, and it says 21 here, but that has changed since we sent this out. So it's actually 22 members out of 30 replied and said, here's kind of all of the answers to my questions. And you guys gave some just really meaningful, really thoughtful questions that were so helpful to planning this discussion and helping center us. So we really do appreciate it. We're going to keep saying that too, because I can't minimize. I can't at all tell you how helpful it's really been. So thank you for that engagement and thoughtfulness that you brought to the conversation even before we got here. But just to reorient us, we've got about a little over an hour left, which is great. It means we're slightly ahead of schedule, I think. It's always great to hear. We're going to spend that time really talking about these 3 different lanes of discussion. First, we're going to tackle some additional budget exception type that you've all proposed through that survey, and that'll be about a 20-minute discussion. And then we're going to jump into some of the places you all asked for more clarity, found things unclear in the proposed budget exceptions that I just went over, and that's going to be about 30 minutes. And then just to kind of wrap us up and make sure that there aren't any outstanding looming things that we want to make sure we're talking about, we're going to revisit any of the questions or comments that you may have after our discussion today. Leah is going to be our timekeeper and helper. And so I think one thing we've asked her to do is say, hey, you know what, we're getting close to our 20 minutes or our 30 minutes, and have a pause to say, is this where we want to spend more time, and we'll take time away from other topics. So really trying to be flexible to the needs of this conversation as we get going here. But I'll set us up for that first budget exception type discussion if we can go to the next slide. So in addition to all of those proposed budget exception types that I went over in the last few slides, you all proposed a number as well. We took every proposal that we could see in the responses and put it on this page. And I'm going to go through each one of these. I do want to call out that in some cases, these are things that federal government has said we couldn't do. Any one of those things that are more tied to other parts of our programs. So it isn't that all of these are like, yes, we're going to do all of those, but we wanted to have a discussion and also understand that we have limitations going into that discussion as well. So to read through these, the first one, and these are in no particular order, is trauma-informed care requiring expertise or training for providers. The next is a housing transition or disruption of service causing a bump in need for a period of time. Then we have budget exceptions for cultural or language barriers, transportation, home or vehicle modifications, social and community integration, leave days. And I'm going to decode that one because that's a very insider language we've got there. This is something that kind of comes out of the DWS rate structure, specifically when we're talking about residential services. There is a built-in capacity for payment for days, just covering the payment for days when people aren't in the home. So if someone is going to go on a 2-week vacation with their families and they are living in, let's say, a community residential setting, it's not like it's an Airbnb and that provider can just be like, for 2 weeks, we've got this bed open, right? We have to understand that that's a revenue lost, and we have to make sure that our providers continue to be viable. So there are options for leave days if providers see that those beds are empty and they can't bill for services. So that's an insider language there, right? I want to make sure that everyone could kind of come along with us on that. The next one, moving over to the second column we have on this slide, funds for unattainable state plan service allotment, unable to access due to lack of staff or providers, requires the use of waiver services to meet the need instead. How I interpreted that, but I will welcome as we get into the discussion, the author of that one, is that sometimes we have people who have state plan service allotment, let's say PCA, but there's no staffing to be had. And so they may not be able to use that. So that's something that's been proposed here. And I may be interpreting that wrong. So again, that author is more than welcome to jump into our discussion today. Next, we have health and wellness, then a budget exception for overtime rates for staff. Again, I think that ties out to when we're thinking about the rates for services and that connection to the budget. And then last but absolutely not least, caregiver aging needs. The age of the person getting help and the age of the person providing help impacts the services and supports. So before we move on to the next slide, I want to call our attention again to that discussion guide that we did provide for you. We're going to flip over to the next slide. And so these are going to disappear, but they are provided for you. And hopefully you did some work and you've got some notes and you're ready to have a great discussion. But if you need to remember these because you don't have a photographic memory, that's for sure me. Here they are, and they're also in that discussion guide for you. So I'm going to say next slide, and I think Leah's going to get us kicked off for our discussion.
Megan, thank you so much. And given that there were so many ideas on the previous slide, we can certainly go back to that. But in thinking about those ideas that Megan just went through, which came from those of you who provided survey feedback, we're asking now for people to maybe elaborate on any of those items, or maybe you have a different thought now that you've had some time to talk about this morning. Maybe something new has come to mind. Also, if people have a story to share that exemplifies exceptions, it's also would be a great time to have any personal shares so that we can understand how exceptions work. So I'll open the floor and ask for people to, if you could raise your hand, that would be useful. I see Trisha has their hand up.
Sorry, guys, I'll put it down. It's up from before. I never put it down.
Oh, that's okay. Next,
don't
we
know.
have Bud and then Polly, and I'm just going to repeat if everybody can be mindful of the captioner and speak slowly so they can capture what we're saying. So, Bud, you'd be up next, and then Polly after you.
Hand up because my aide ain't with me, but whenever you get a chance to let me in, let me in. Thank you.
Oh, Abdella, okay, Abdella will add you to the queue. Yep,
Thank you.
Bud, Polly, and Abdella. Go ahead,
Thanks.
Bud.
Thanks. This is Bud Rosenfield with the Ombudsman's Office. I actually had a request for clarification. It wasn't clear for the list of proposed budget exceptions that DHS staff put together. Were those based on a sort of anecdotal experience, or were they data driven? In other words, it made sense to me. A lot of them made sense to me, but it wasn't clear whether they were coming out of experience with rate exceptions, experience from lead agency decisions to increase individual budgets, or experience based on legislative approval of CDCS budget exceptions. There are a lot of different ways that you might have got it, but it wasn't clear where they came from. Thanks.
No, not a problem. And I'll answer this really briefly, and then let's recenter our conversation on this discussion question. But this really is the answer to was that what drove it is yes to everything. We've got some that are really driven by gaps that we would see in the analysis as we move forward, right? We know not everyone is included underneath the budget methodology because one size does not fit all. We know some of this does actually come from anecdotal, whether it be from people and families and what they've shared with us, both CDCS and traditional models, as well as lead agencies. And I think we called that out when Sandy was presenting. If we talk about a transition age, that was something that came directly from lead agencies saying, hey, this is a gap we're seeing. People aren't able to move out of residential settings and just kind of become lifelong because they don't have a support system there. That transition time makes a meaningful difference. We also see some of these things coming and being proposed from conversations we've had here. And so for us, it's been a lot about being data driven, knowing the gaps we have, knowing the gaps we're already filling, but using a listening ear and saying, where are we seeing anxiety? Where are we seeing people say, hey, this does not represent me and I'm feeling outside of that? And then trying to really focus in on that. So it really has been a very wide net. It's not just data driven. It's not just policy driven. It's not just people driven. It's driven by all.
Thanks, Megan. Next question is Polly and then Abdella. So Polly, do you want to go ahead?
Hi, this is Polly Owens, and I'm a volunteer representative of the ARC Minnesota, and I'm also a support planner for people using the consumer-directed community supports option of the current waivers. Excuse me. A couple things. I had mentioned in my stuff that I submitted before, funds to develop a positive support plan, and I don't know if that fits with the trauma-informed care. But I know a lot of providers and individuals are more familiar with the term positive support plan. So I just wanted to make sure that there's an exception for people to be able to temporarily develop that plan. And then this may fit under safety net or emergency, but funds to assure people who live in individual community settings to make sure that their needs are met to prevent them from moving to a provider managed setting if their choice is to live in an individual community setting. There may be a need for an increase in funds to make that happen, like because of staffing or services available. And that could fit under emergency or safety net, but I just wanted to verify that our underlying philosophy is that people live in community settings, can stay in community settings as long as they possibly can. Thanks.
Thank you, Polly. Next, we have Abdella.
I just want to say that, in talking about all of this, I don't hear a thing, about seniors and how would it apply when that process comes of turning 65, because all the people with disabilities, they're gonna get old, and they're gonna reach that, and some are reaching it as as this stuff is being implemented. The other thing is, you had said a personal story. I myself, I currently on the waiver program, and has benefited from it, coming from a coma and multiple head injuries. And with the current program, I've been able to maintain a level and then to gain a greater level. But we're talking about a time of many years, and now I'm going into another process, and that's over the age of 65. And so in the two waiver system, and I've been on this committee, for a while now, and I've been getting a lot of help and accommodations. Thank you, by the way. The county and you guys are doing a good job in keeping me, up with the aid that I have outside. The personal story would be that now that I've turned 65 and the process of not having the credits due to, the interruption in my life as far as becoming more disabled than I already was and not being able to attain the requirement that's required to make that transition as smooth as it would be for you guys who don't have a disability. Um, what's in place in there, which there's nothing for the rest before now coming up to it. I haven't heard a whole lot, and I won't take up much time, and I'm being time sensitive. And if there's any way with the individual, thank you for helping me with the accommodations. I'll take it up, on the survey. But I think that that's something that should be looked at in the budget exception reasons too, unless we just gonna forget all about these people with disabilities when they cross that threshold, or the or just the seniors, and because our parents are, your parents are, and one day you are. And with that, I'll move on to the next.
I just want to jump in real quick. Ardella, this is Sandy Zolzer. We had spoke on the phone not too long ago, but you did make some very valid points about the transition at 65 into aging services. And I did note a lot of what you said as you answered questions and provided information. So certainly I'm bringing that back in our discussions about what potential budget exceptions, how that might affect things. So we do need to look at that a bit more. I'm not, I know some of the issues were not necessarily related 100% to your waiver services. It was just the transition and in what changes with other systems like health insurance and Social Security, those kinds of things. But
they all impact the waiver system.
yes.
All of those things impact the waiver system and how the person centered and how the individual choices are made, and the budget and the budget reason, all these things that you guys are talking about and that we're discussing here that's in these slides, all of that stuff is impacted, because the decisions will be made by those individuals in authority based upon, what finalization outcome is arrived at with what we're discussing here. So, we have that system and this one, not that they supposed to integrate, but I'm saying that, they're impacting, my life, the changes, and not just me, but there's others, and others to come. and your parents gonna come too.
Yes.
And we want things in place for them and our future generations.
Mhm.
There are something there.
Mhm.
Yes,
I
yep. I thought, like I said, I thought you made some very valid points, and so we definitely noted your feedback and appreciate that. So to bring to the table for figuring out how those impacts affect future budget exceptions. So thank you.
Great. Thank you, Arbdella, for sharing that concern about age in the and exceptions in this system. Next, we've got a comment from Kate Barton about transportation needing to be streamlined. She says, I don't often use my waiver funded transportation to get to medical appointments. My transportation funds are for community integration. Is there a way to allow waiver funded transportation to be used for medical appointments? My case manager told me that I can't use it. Medical transportation is hit or miss. So
So we can note the transportation piece, not a service expert or even a transportation expert. I don't want to speak too much to it, but what we'll be taking back, Kate, is exactly what you're saying here. Transportation access is important, and figuring out creative ways to integrate that into the budget or into the decisions, or if we need budget exceptions, definitely. And I know we also have that on the list in the previous slide. So thank you for re-upping it.
Thanks, Kate and Megan. Next we have Lisa, and in the line is Sherry and Bud. So Lisa Evert.
I just want to clarify or talk a little bit further. So in the list of proposed exceptions that would have come from our survey, and the one highlighted, or that I highlighted, is stating that funds for unattainable state planned service allotment, that line. Help me, and I don't know who made this suggestion, but what I'm reading of that is what I said earlier, when we still have some fuzzy area on inside and outside the budget. So state services being funded outside your budget is a concept that we still need to get clarity around. But if I'm understanding this suggestion for proposed exceptions, would it then make sense that an exception could be that outside funds, if it can be utilized better inside your budget, the exception would be move those funds back inside the budget to be fully managed under the CDCS plan? Is that how everybody would read that suggestion? And maybe that's for Megan. Is that how you're reading it?
I think part of your question here is getting to some of the things we're not determining today is how much in the process. But I think if we were thinking about that and saying, hey, we can't access services that may be outside of the budget, we would need to access things that are inside the budget, whether they be state plan or not. That could be something there. However, I also want to call out, and this is me dabbling slightly in services, so I don't want to get too far out over my skis. But saying, we do have that the waivers are the payer of last resort. And if you're not familiar with that, right, we do have to use all other programs before the waivers can pay for something. And so at least that's my understanding, and all of my DHS friends can come on to correct me if I'm wrong there. I'm the money lady. But overall, we need to really make sure that those programs are being utilized before we get to the waivers. So we have to determine where that line is too, right? So that criteria we might have to vet out a little bit more. We might have to have more discussions, but I do see that, right? If we can't access those things, where can we build them into a waiver budget? I hear you, and that would be how I would interpret that as well. I would open it up to other members though. Is that how we're also interpreting it, or is someone or the author of that one want to offer additional pieces?
Does anybody have any clarifying comments? And why don't we go back a slide so we can see that language, Claudia, if you're able to. It's the top bullet in the right-hand column, funds for unattainable state plan service allotment. So does anybody in the meeting today have any clarification on that?
When I looked at that through the survey, that's exactly how I interpreted it too, was meaning that they've searched for, you know, state funded services, like maybe a PCA provider or something like that. And there's, you know, we know the staffing shortages, we know there's limited resources out in outstate Minnesota, well, all over Minnesota. So that's exactly how I viewed it too, was if they weren't able to find that, are they going, and their only option is to find a waiver funded provider, then we would need to look at, is that a justifiable budget exception? So it does need to be, gone through to determine what criteria. But I thought that was a very fair and very good suggestion to pay attention to.
Thanks,
Could-
Lisa.
Could
Go ahead.
I just jump in then with a clarification? Megan made a good point to remind us all of payer of last resort. So waivers being payer of last resort and state funded services, if I'm saying that correct. So outside your budget is a very important concept. So whatever the dollar amount that's provided to a person outside the budget, is that money coming out of a different pot, so to speak? And I'm thinking, in my mind, it's a super easy thing to say, what that bullet point is saying is an exception is very acceptable across the state of Minnesota when your situation justifies outside money just being slid inside. But if it's not that easy because it's two different pots, so to speak, can you elaborate on that?
It's kind of both. When we talk about state plan services, that is another pot of money, right? It's not just to slide it in and use it. However, again, I'm not the expert here. I'll just throw it out as an idea. We have the CFSS implementation occurring, and so there is some self-direction options in that lane as well. Though again, not experts. If that's something we'd like to talk about, that's something, you know, we can put in the hopper. As far as the interconnections there, those aren't all worked out yet. There is also services that are waiver services that are outside of the budget. So to call out something here, home and vehicle modifications is on our list to talk about for budget exceptions ideas. Those are something we propose to be outside of the budget. So we wouldn't need a budget exception because it doesn't apply. So some of those things are waiver funded. So it's a little bit easier to go in and outside of the budget if we're looking at it, right? And that might be a little bit of a gray area with self-direction, which I know is the lens that you're often coming from too, Lisa. It's a little bit more malleable. If we think about it in the traditional services sense, it's kind of like it's this service or it's that service. So it's a little bit more concrete. But then there is also other programs, not just state plan services, but even Katie brings up the need to interact with medical programs or your insurance or any one of those things. So right, really building a robust plan for someone. And again, even getting, I think, a little bit of what Arbella was saying is there is interactions with a lot of different programs. And our goal here is to make that as seamless as possible. But we also have to figure out what the jurisdictional rule is. And big fun words there, right? But where the rule and where the limitations are about using waiver funding for those things that are provided in other programs. So that's a big piece of it. And that's part of why we really want to get to clear definitions and clear lines, because it helps us understand when those rules don't apply or when we can't break those rules too, if that makes sense.
Sure. Yep, that's helpful. Thank you.
Thanks, Lisa. And then we are at time, but there's 3 other people's hands up and 2 comments. So I'm going to look to the DHS gang and say, is it okay if we carry on, go with the flow and take people's questions here? Okay.
I think since we're hearing some of the clarification conversation, it would be really helpful for us.
Yes, because a lot of this was the stuff I was going into to clarify. They're bringing up points from their survey, which I was just going to revisit coming up. So,
That's
certainly
great.
we're covering the stuff we needed to. So I say keep going.
Thank you. Thank you for being flexible. I'm going to read a comment by Dr. Kate Jarek, and then next we have Sherry, Bud, and Zania. So Dr. Kate types, the rates seem to cover the rate for a typical PCA, but don't take into account the need for a PCA with higher skills for like trauma-informed care. There needs to be an exception for this. So we can add that to the list. And next up, we have Sherry Pickthorn.
So I'm I'm out of southwestern Minnesota, and we have a lot of rural communities, and so we really struggle with a staffing shortage to find people that are willing to travel to these rural areas. So if we do find staff, if we're fortunate enough with that, it may be 40 minutes away. And so by the time a provider pays a staff person their wage to drive there and their mileage, because otherwise there's no other person to do the service, they're saying it's a hardship financially for them to do that. So then sometimes we'll have providers then that will just deny and say we can't financially make it work. So that's an area that I think in rural Southwest Minnesota would be a benefit, is if there was some type of an exception to consider the distance that to find staff. And then the other one I just wanted to talk about a little bit is the overtime. We're seeing, because of staff shortages, of course, we hear this all the time, right? That it's your supervisors, your highest paid people that are doing a lot of direct care at overtime levels. And so we have a couple providers that are operating in the red because they can't continue to operate paying their highest level people overtime because of the staff shortages. And I'm concerned we could lose providers if we can't find some way to help compensate some of that.
So thank you for your notes, Sherry. And I do want to call out, and we're taking that back, and of course it's right here. I do want to call out that the things that you proposed are changes to the rates. So those may need to kind of parking lot and have further conversation, maybe outside of our budget conversation. Of course, everything connects, so it is a little bit hard to kind of parse it out. But when we're affecting the cost of a service, that is the rate. So we want to make sure that we're thinking about that too. So we have rate staff on this call. We have rate staff listening in. So let us take that back and parking lot it and see how we can't tie it in. But I do want to be really open and transparent that what you're proposing are changes to rates, not necessarily the budget.
Okay. Thanks for that. We have a lot of hands up, so we'll keep stretching this time longer. So we want to hear people's voices. Again, just reminding people to speak slowly so the captioner can capture this. And next we have Bud, and then we have Zania, and next we have Kelly. So Bud, you're up next.
Thanks. I have 2 points to make. One on one of the proposals that I had submitted, and then just a follow-up on the prior conversation that actually overlaps with Sherry's about rates, about the unattainable services and rates versus budget. I think that the option of doing self-directed, especially with CFSS and extended CFSS, once that replaces PCA and is in the waiver, raises a lot of complications, because the line between a specific service in that rate or your entire self-directed budget gets blurred, depending on whether you're doing a la carte or all self-directed. And the impact that any increase on a particular rate has on your overall budget could mean you need both a rate increase and a budget increase. So I realize we're not dealing with all that now, but that has to be a parking lot issue that we come back to. And the whole rates issues around self-direction, how self-direction works and impacts on the budget is a topic probably for an entire session. So thanks for hearing me out on that. One of the suggestions that I submitted, and others might have submitted it as well, had to do with how we're paying for environmental modifications, vehicle modifications. I've had clients who need to install elevators. Depending on whether you're on CDCS or on traditional waivers, that gets handled different ways over time, but it's a huge budget expense. Oftentimes it's a one-time expense, but sometimes people have significant equipment needs that carry over year to year. And we just need to figure out if that's going to be inside the budget. Those are budget blowers. They won't be able to cover a huge expense, vehicle modification or an elevator within a typical annual budget. If they're going to be handled outside of the budget, that's fine too. But right now with CDCS, it's kind of a hybrid. So we're going to have that discussion. And if it comes back to it being within the budget, then it needs to be a budget exception. Thanks.
Yep. Thank you.
Thank you, Bud. Next we have Zania, Kelly, and Rosalie. Zania?
Hey guys, this is Zania. And the item that I wanted to talk that I put in the survey was for cultural and language barriers. As it stands right now, I could be wrong and someone can correct me, but I have not seen any type of budget considerations or rate considerations or even exception considerations for culturally specific and culturally aligned services. Just to give an example, you have some languages that are rare. And you have languages and cultures that are rare that require specific considerations, and how are people expected to pay for that? Especially like providers that are providing the service. So example, if you have a PCA provider or an IHS provider that can't find someone that speaks that language or that is aligned with that culture, who pays for getting the interpreter line in, and who is taking up that cost? Another thing is when we're trying to provide culturally aligned services with things like food and religion and different things like that, like that is a higher cost, and you won't be able to find staff that can provide those services and care because they will go work somewhere else if the rate and if the budgets don't align. For example, if we're looking for an IHS worker or PCA worker to work with someone that speaks Korean, like just for an example, or another dialect from Africa or somewhere else, what would make them want to come work in this field with the rates and with what they're being paid and what's in that person's budget versus going to work somewhere else where they can where they can be paid appropriately. And so that's just something to keep in mind, the cultural barriers to care. So.
Perfect. Yes. Thank you.
Thank you, Zania.
I'll add, Zania, while that hasn't been a main focus of our conversations within RAC, there are many, many conversations happening about how we tie that in within rates, within services, and all of that within DHS and with stakeholders. So that might not be a main focus here, but thank you for bringing it to the conversation.
Thank you. So we'll take Kelly and Rosalie's questions next, and then we'll move on to the next topic. I also just want to pause here and read what Kate Barton put into the chat, which is health and wellness should be automatically available to everyone. So just expanding on that item in the point. Not many programs are covered by Medicaid. Health and wellness can be a variety of things, such as weight management, exercise programs, and mental health services, and they're often not affordable. If they were under the waiver, they could be available to be used for what they need to achieve community integrated health and wellness. So thank you for that, Kate. And next up we have Kelly, and last we'll have Rosalie.
Thank you. This is Kelly Friedman, and I'm a parent. My question is, and it's more of a clarifying question, we've been talking about some great things about exceptions to budgets. And I guess a big concern I have when I talk to different parents, including my own experience, is that sometimes as if you use a CDCS model, you believe that something is going to be helpful for your child to progress. And when you look at the different, and I'm a big rule follower, so when I look at the rules for CDCS, I look at something and I say, okay, this should be covered. And I might go to one worker who says, yep, social worker, yes, it's covered. I go to the next one, they're like, no, it's not, which really concerns me. So you get this real discrepancy between not only just like counties to counties, but worker to worker, who will approve things and who will not. And so my question behind that, which gets really even more frustrating, is when a person has money left in their budget, where does that money go? Like, does that go back into the county? Does it go back into the state? Is there somewhat large fund? Because it just seems that for people who do have the leftover money, it's frustrating that we're not getting them the services that they feel would be helpful for them.
Sure. So I am going to take part of that question and table part of that question. I think one of the reasons we're looking at really drilling down into the criteria or the reasons we would have budget exceptions is to the point that Sandy said, it's a really detailed process. And the clearer that we can make the rules around when we get to break the rules, right? The clearer we can make guidance, it means that case managers can interpret it the same way across the state. The counties can interpret it the same way across the state. And that's a big value here. Whether you walk in the door in the Southwest, the Northeast, or the Metro, or anywhere in between, those rules should be the same and they should be clear enough for everybody to understand them, right? We want to create a system that is not based on the privilege you have for understanding that this is a complex system or the relationship that you may or may not have the opportunity to build with your case manager. As far as the unspent parts of budgets, we should be advocating for everyone to spend as much as they need to support themselves. However, where those funds go is an incredibly complex piece. It's not just sitting in a county for them to shove to somebody else with the new budget model. It is not just sitting in like a big fund, right? We fund what is spent. So there isn't some sort of like, here, we're just guarding all of our resources at all. But we're going to table the rest of that because we've had that conversation a number of times and I want us to keep moving. So thank you. Put it in our parking lot.
Thank you. Thanks, Kelly, for raising that. And last, Rosalie.
Hi, this is Rosalie Eisenreich from SEMSIL. I had a question just as we talk about these exceptions. I did want to highlight, as did Bud, about the state plan and like the CDCS complexities. But I'm curious if we're taking a look as we're talking about this, and if we could even get information, perhaps, if there is data available on, what's happening right now in the system around persons that are, the costs of people staying in residential settings or in settings they don't want to be, because there's a lot of people right now that are forced into nursing homes, that are being forced to stay into hospitals in the name of the workforce shortage, and to the point of like making funds attainable for people who are having difficulty staying in their own home because of staffing or because they're already been forced into a placement that they do not want to be in and are trying to get out. Like, do we have data to show, like, is this something that's being looked at, and can we even see that right now, just as justification for some of these exception proposals, to see the analysis of what it would cost or what it's costing us now with all of these growing issues around the workforce shortage, to be able to provide an exception, and how that might offset then someone living in a more costly facility.
Rosalie, we've looked at this in the past and we've had a few conversations around this as well. I don't really want to say we're not going to talk about that, but I'd like to put that in a parking lot and we can have that conversation offline and then provide any of those resources to all of our RAC members, because right now we're running short on time and this isn't about the budget exception. I get that this also plays into the budget exception conversation, but I'd like to take that offline right now because there's a lot of different pieces of the puzzle, a lot of work going on in DSD to look at this. But it's incredibly complex. So I would like us to keep moving. So I'm going to ask us to table that for right now. But I hear you and we'll continue to have the conversation we've been having around this.
Just know that everybody's comments are taken into account and we will hold those for the appropriate conversation and time. So thank you, Rosalie. Julie, I'm going to ask you to hold on and I will come to you if we have time. We've stretched this over an additional 10 or 15 minutes. So let's go to slide 31, I think. Yes. So now we're holding space for any unclear exception reasons. So this is when people submitted things in the survey on budget exceptions, some of those things were a little bit broad. And so we're looking to you, to those of you who submitted these, to expand on them. Now, fortunately, we had some of that in the previous conversation. And there are 2 slides here to take. So I don't know if anybody else wants to speak to this. Megan or Sandy, but
Yes, yep. So in the pre-work survey, there was budget exceptions that we saw, like Leah just mentioned, that resulted in more frequent comments and questions. And we wanted to spend some time to allow members to elaborate their thoughts and clarify the information. Some of it was just talked about, so you might hear a repeat of things that I pull through, because the exceptions that I'm referring to are on both slides 31 and 32. So you'll see the items there. We've allotted about 6 minutes for a discussion of each of those topics. And to help the members recall their questions and concerns, I will review the budget exception definition that we have proposed. So if you need a visual, you can find those definitions on your discussion guide, or they are also on slides 26 and 27 of the PowerPoint. So we can certainly go back to those PowerPoint pages if needed. You just have to request that. But as I go through each one, I'm gonna, like I said, go through the definition, and then I went back to the survey and pulled the specific questions that were related to that topic, just to help jog people's memories. So if you recognize something you wrote or had further questions or wanted more clarification, I'll allot time for that. So beginning with emergency need, that's shown on slide 27. That in the proposed exceptions was defined as people experiencing death or sudden loss of a caregiver, temporary emergent relocation, or another event causing a significant increase in the cost of services needed. So when I went back and looked at the surveys, there was a comment requesting further clarification about the last part of that definition, another event causing a significant increase in the cost of services needed. To revisit what Megan shared earlier, this exception was meant to capture unexpected events that caused disruption in service changes. So like she mentioned, fires, floods, natural disasters, a primary caregiver's death, or other types that would result in an emergent relocation. Did you have thoughts about that further? Does it make sense, or does it need further clarification?
So are people clear on that, Polly?
Hey, excuse me. I was just going to say that for that one, based on my experience and people's comments about how different case managers interpret things differently, different counties interpret things differently. I think it's really important that there be some kind of online list or something where somebody's had an example of something that's been approved under this emergency need, so they can check and say, oh, so-and-so in Pope County got this approved, it should work in Houston County. Just so that because you don't want to delineate everything, but you want to have some resource, kind of like the help desk or something, so that case managers can do that, and it isn't going to be like it is now with 87 counties doing 87 different things in response to things.
Yep, I hear you, Polly. That makes complete sense. And like Megan referenced earlier, the more we can make these clearly defined, and when we get to the policy drafting portion of it, the more detail we can put in there, I agree, the better that will be for, across the state. So thank you for that.
Just one more
Polly.
thing. This is Polly again. I just so you don't make it so black and white, it doesn't look at individual people's unique needs.
Mm-hmm. Yeah, that's a fair point. So
thanks, Polly. Next we have Trisha.
Thank you. This is Trisha, and I just wanted to, really drive home the point that, currently the way it's done is, yes, we have all of the different counties interpreting things differently and saying DHS told us this is how it has to be, rather than, banging our heads against the wall thinking that, oh, we can provide clearer guidance. Maybe we could think about looking at an improved process or some kind of accountability or oversight to that process, just throwing it out there. I know we can't go into it now, but I think it's important that we talk about, not doing the same thing over and over and expecting better results. Thank you.
And that goal of clarification, which keeps coming up. So any other further expansion on emergency need or questions about that? Otherwise, we'll move on to the next one, because we do have some more on another slide.
Note, Leah, there was also one, and you'll see it in the slide. There was a question regarding if service termination should result in an automatic emergency exception. And I just wanted to get people's thoughts about that. you know, does that make sense as a line item? You know, what were the thoughts behind that?
So thoughts from people on service terminations being an automatic exception.
I think it should automatically be considered.
This is Zania.
Yep, this is Zania. I think it should automatically be considered because service terminations can happen for a number of different reasons, especially like exceeding the level of care, you know, that where the current service provider is providing care. Like, you likely will need an exception pretty quickly, and you know, depending on the time frame, it may need to be expedited as well. So I do think that would be a good idea.
Thank you, Zania. Does anybody else have input on service terminations being an automatic exception? Julie agrees they should be automatically considered.
I agree with Zania. I'm sorry for busting in, but if we don't thoroughly address these things, work that's already been done with the current waivers and the formal, that stuff is gonna start over and get lost in the shuffle. So I just want to add that in there too,
Thank you,
because
Abdallah.
you know it's not a whole lot being addressed in certain areas, and that culture is one. And since the last waivers, you know, we got all kind of different cultures and people that have, you know, that whole platform has changed. I'm done.
Thank you, Abdallah. Bud, you have a thought on terminations being an automatic exception?
Yeah, I tend to agree that they should be, but I think this is another category where we have to distinguish between service rates and exceptions and budget exceptions, because if you're in a provider controlled setting and you're only getting one service, they can be basically the same thing. But if you're in your own setting, or even if you're in a provider setting and you have other services, it can get more complicated. Increasing the rate for that provider doesn't necessarily fix the entire problem if you've got other providers who also need an increased rate. So I think it depends on what's being terminated and what kind of setting the person's in. Thanks.
Thank you. Any other input on terminations as an exception? Otherwise, we'll go on to the next one. Okay, thanks everyone. Sandy?
Okay. All right, the next one that was needing some clarification was the temporary transition that's shown on PowerPoint 27. It's defined as people transitioning from a residential hospital or other institution setting back to an individual setting. There was questions wondering if this would be a time limited exception and for how long. I just want to clarify that the intention is for it to be time limited while the individual is getting back to their baseline and managing their previous needs. We're talking about people that may have been injured, you know, need time to heal, have become significantly sick, but are expected to recover over time, possibly had a surgery that results in a more lengthy recovery period. This would not be meant for someone that you know has a new diagnosis and is needing a long-term service change. If the individual is not expected to return to their baseline level, or finds that in the transition period they are not going to get back to that, then they would most likely need a new assessment to assure that their needs are properly reflected. We have not set the time limit for this one. We're not that's certainly we're open to discussion on because you know current rate exceptions are renewed annually. And so I guess we were just wondering what are the thoughts and comments about this exception definition, and did people have ideas on what would make sense for a length of time?
So thoughts on how long a temporary transition should last? Now I see Julie put something in. I don't know that this is related because it's about age-based transition. Just a comment that 18 to 25 seems arbitrary. Should it be stage-based or need-based transition? Being that it's transition, I thought I'd throw that in there. Lauren, you have your hand up.
I think that
the circumstances around the temporary exception could be a consideration. Of course, that sounds redundant, but what I mean is, like, if they're having a specific surgery, then what the medical team is saying about the recovery time for that specific surgery should be a consideration. Or what the PCA provider is saying about the staffing shortage should be a consideration.
So situation specific then, Lauren?
Yes.
Okay.
And I believe that service providers and also medical providers should have input on that.
Okay, with input from service and medical providers. Thank you.
Yes.
Yes,
I
thanks for that.
Any,
Can
yeah,
I also just say, I feel like whether or not people pursue any of these things depends on how quickly these services can actually be implemented after they request for these exceptions.
That's very fair, Lauren. And when we get to that part of the process of development for exceptions, that will be important to look at for sure, because we need to, we're not at that stage. We're going to define these, but when we get there, that will be an important factor on looking at what is the process for getting things approved and processed. So
okay, thank you.
Thank you so much, Lauren. Next, we have Bud's hand up. You have a thought on how long temporary transitions should last?
Yes, thank you. This is Bud Rosenthal again from the Ombudsman's Office. I think, Sandy, the way you described this then as being more focused on people who say had an acute care need and now they're transitioning from that acute care need should probably be embedded in the description. I read this more broadly to include people who are trying to get a FMHP or a NOCA, those high need settings, and it's really difficult given their background, not just their needs, but sometimes other things about them, criminal histories, that sort of thing. It's hard to find providers who will agree to serve them, and you just have to pay more. And in those situations, I'm not sure if we're talking about that group of people, I'm not sure where they're captured. They might be considered in the high or above average health or behavioral needs, but not necessarily if they don't meet those staffing levels. They might be in the high needs setting, but I think that we just need to be specific about covering those groups of people too, because they've always been a challenging subpopulation for the counties and DHS. Thanks.
yes, thanks, Bud. And we did try to capture those people. You know, that does come up. We've talked about them. I think they're more clarified in the high need setting. And so, or thought about more in the high need setting or the safety net potentially. And that is where we wanted to get some clarification on those topics coming up. So very fair point. Was there more than?
Kelly's just kind of reinforcing that Julie's point about transition age. With age shouldn't be a factor, as everyone is different in their developmental path, so moving out may not happen until more skills are developed, which may be later in life. In addition, transitions may occur more than once depending upon what is going on in their life, which is what Bud was talking about. So I think we've heard from that. Should we go on to the last bullet point here?
Sure. Sure. And yes, I'm just to add on to Kelly's comment, you know, that was a lengthy discussion where we just kind of grabbed, talked about where should we come up with, you know, where should we set the time frame for youth? Like I said, that example came from a recommendation from a lead agency. And so when we looked at the age-based transition, we just pulled from the family support grant criteria. Their typical age of service, you know, is that 18 to 25-year-old range, but that is not set in stone and certainly can be talked about for how does it impact different people. And maybe we need a separate exception for certain areas too. So thank you. The next area that we wanted to clarify for people was 24-hour staffing. This one is shown on your PowerPoint 26. It's defined as people with an established need for higher staffing in an individual setting to maintain their health and safety. The question on this one that was noted was, should it be expanded to address awake versus sleep staff rates? And so I just wanted to clarify that in previous discussions about this exception, we were looking at, it's meant for someone who needs 24-hour awake staff due to their own well-being or the well-being of the community to keep them or others safe. So we are looking solely in regard to 24-hour care, not a 24-hour plan of care, which are two different descriptions. And it's meaning that the individual does require a person with them at all times. So is there any additional thoughts or questions about this exception that we can clarify?
So further questions from people about the 24-hour? Lauren?
Well, when you say that, it just occurred to me that there might need to be more clarification around people who use vent and trach, because those people, a lot of those people use 24-hour, and so that's going to be a huge factor for them.
Yep, it is. And that's what we were talking about. The people that need those high level cares for their, it could be for a medical need, it could be for a safety behavioral need, it could be for a multiple full facets, but we were looking, the primary thing was to be looking at, and we struggled with what should we call this? And so, I think we've talked about the 24-hour staffing was where we came up with as a final suggestion, but that's also open to maybe providing a better descriptor of it. But I think the main point was just so that people were aware that that it was for 24-hour care, and whether that was awake versus sleep staff, it would just be those that are needing someone with them 24 hours a day on site. So.
Thank you, Lauren and Sandy. Lisa Evert has a thought on the 24-hour exception.
Yeah, probably just commenting or asking for clarification. So reminder, I'm a parent of a 25-year-old that has high need and needs 24/7 care, meaning her needs, if I was to leave her without a human being caring for her, I would probably be put in jail as her guardian and not managing her care. So for clarification or a comment, obviously, if you have a person that now needs different staffing temporarily, that's an exception. But if that person, due to diagnosis and need, has been there day one and would never change, and I'll use my daughter as an example, due to her diagnosis, that would never change. She would never need an hour of her life not supervised. So to me, that should never be addressed in an exception mode. It would be captured, or should, in the min choices screening, and thus budget following. And so where I start to get concerned, and it kind of goes back to sort of that general feel of that 11% of utilization of waivers, that 11% person, it's like our whole discussion keeps evolving with this back tone of the waivers are here for people with disability needs, special needs, but then it's like, well, you're too disabled. You're a little too disabled for our framework. And so I just want to make that observation that, like this 24-hour comment, it's one thing if it's temporary, but if it's always a need for who they are and what their needs have always been, it should never be an exception. And we shouldn't be feeling like we're too disabled for this program in Minnesota, if that makes sense.
I just want to jump in.
Go
Sorry.
ahead, Megan.
Lisa, I hear you, and I appreciate that, and we're going to take that back. I think that's a great reflection, and not ever intended to say you're too disabled. I think where we come from on this is creating a budget methodology that works for the most people that it can, with the recognition from a person-centered perspective that everyone is different and not everyone is going to fit within one methodology. In order for us to say, okay, everyone at this support need needs 24 hours of care, means that we would also not be financially responsible, that we're held to and the legislature is held to around funding things to the level people need. This is one of those places where it is a little bit in conflict, right? Because we don't necessarily want it to be something, well, here's this whole group of people and they have to work completely outside of it. And that's not the intention here. But there are going to be situations, and there's currently situations where people have budgets or they have rates that they have an exception to, and they continue to need that because we have to build systems that can engage the most amount of people possible with also fitting into the rules. So I hear you. We're going to keep doing our best. Recalibration is another swing across the plate for us to really make sure that we're meeting as much as we can with the recognition that we don't just want to say, sorry, you're too disabled, you can't have access. We want to find a pathway forward for that access. So I'm hearing you, totally taking that note down. Thank you for sharing that and your vulnerability here with the recognition that within a system, we still do have those limitations and we have to create spaces for that as well.
Right.
Thank you so much for sharing that.
Right.
We've got 5 minutes and we have another slide of points to go through and then kind of open questions. So, oops, some people who had their hands up, put them down. Okay. I just wanted to check on that. Can we go to the next slide then? Sandy, are you okay with that?
Yeah, go ahead. Yep, I'll jump in there. And so this is the next one is high need setting shown on slide 26 for the definition. It's the people who haven't been adequately whose needs haven't been adequately supported by customary staffing levels, or similarly, people who have not yet found a residence with adequate support or trained staff. And the survey comments regarding this wondered if it should be called a high needs situation rather than setting. And the other questions included, what is the standard for not yet found? Is it a certain amount of time or a certain amount of residence that they've looked into? So I just wanted to open that up for thoughts about about those comments regarding high needs setting.
So, input on high needs setting.
And I do think this is where, like the comment that Bud made earlier, this is where that would fit into. Those people that we struggle to, that are coming out of Anoka or those places that, this isn't the setting, that they want to land in necessarily, but, making room for how can we meet their needs when they're difficult, when it's difficult to find them the right supports.
So thoughts or questions on or clarification on the high needs setting question that Sandy asked the group?
I think that through all this, we need to pay close attention to the person-centered that we committed to. I just took a survey for the Minnesota Council on Disabilities, and a lot of the questions they had pertaining to, what the platform is looking like and how persons with disabilities are, what their experience is like. Because in every topic of this discussion, exception, budget, it's really, really touchy when it comes to person-centered. I don't even hear it being used anymore. I just hear us moving on with what needs to be done.
Thank you, Abdullah. We've got Lisa and Bud. We're down to a couple of minutes, so if you could keep your comments short, I'd appreciate that. Lisa?
So just clarifying, so high need setting, I just say when you can take a step back and say if this particular person's core need is such, it should never be dealt with through an exceptions process if it's a core basic need. I think that's already out of the gate a flaw. That's my 2 cents. Good example.
Thank you, Lisa. Bud, you have a quick comment or question?
Yeah, thanks. It's both a question and a comment. The question is, when we say high need setting, are we only assuming settings that would be on the residential waiver, or can people create a high need setting on the individual waiver. And I ask that because I've worked with a lot of clients over the years whose family and friends or neighbors are able to take care of them, but the CDCS budget hasn't been adequate to do so. And so the question's going to be, and this is Olmsted question, concerns. If you want to stay on the individual waiver and your needs are such that your budget exception doesn't work for you, can you get an exception to avoid having to go to the residential waiver? It's a key Olmsted question. Thanks.
Thanks. Do we have a comment on that, team?
It could be. That's why we're having this conversation. And I think what we're seeing with the reactions is maybe we need to consider what that looks like. So thank you for that feedback.
Thanks very much, folks. Sandy, take us home. Let's cover this last
I'll
point.
just dive into the safety net was the last thing, and we might need to get some outside time for that one. But it's defined as people whose current supports and services need to be maintained with required high level of staff care to ensure stability or endangerment protection for a person. This may or may not be tied to a previous higher support need. The survey comments and questions included, what does ensure stability mean, and should it be a temporary increase to develop a positive support plan? And I'm just going to note, this exception was one of the last ones that we did look at in our development, and it caused a lot of questions all the way around. We also hope to get some clarity through this meeting from members, because in our discussions, we truly question if this was a needed exception. Is it already covered through the other areas of exceptions, such as the high need setting, or the exception for high or above average health or behavioral needs, to cover the intense staffing levels? And we just wanted to clarify, what does ensure stability mean to you as well? So I'm going to open that up.
So questions, we've got a couple of minutes. Do people have answers to what does stability mean with a safety net exception, or have an example to share with the group?
I agree with the last. Never mind. I apologize. No, I don't know how to operate this, but thank you for the accommodation. But the safety net, the level of needs that currently exist, and the individual being able to maintain the stability, at least almost at the level or at the level that it's been, that currently exists. And I just like to put this out, and I'm gonna shut up, and that's the Minnesota Council on Disabilities, Colleen Reck. They got a very, very interesting, very, very valuable survey. You can take it or you can just do it, but I believe that it'll be beneficial for the rec committee and its team that's developing it.
Thank you, Abdullah. Julie, you've got your hand up, and then we will be, oh, sorry, am I cutting somebody off? And then we'll be wrapping up. Julie?
So this one, to me, stability can mean any number of things, and I'll give you some, and I think it's important that it's left flexible to mean any number of things, because, and I'll give you the story of my daughter who was trying to transition from a group home to individual setting. It took way longer than expected. They basically shut down the group home on her. She was moved into a individual setting, and her housing funding fell through the day she moved in. Her entire, the case manager, the mental health manager, the housing stabilization worker, and I think there was one other person, all turned over that same week. It was all brand new, and it was a total disaster. I mean, she literally was going to be rendered homeless if family didn't step in and be that safety net, and that we were able to, you know, shouldn't be the norm. Then it went on to finding service providers, long wait lists, to employment providers that weren't being successful, to changing employment providers, more long wait lists, to her current employment service provider who's saying, well, it's taking her too long. Her mental health needs are too great for her to find employment right now. We might have to drop her. I mean, I can go
Where
on and
our
on and
meeting
on.
is at closing time, so I just want to hear what you're saying and ask people if they could hang on a few extra minutes so we can
Okay.
finish up our meeting. But do you think we have the gist of what you're saying in terms of stability and providing an example there?
Well, it's providing the instability, which hopefully this safety net would then be a plug for.
Okay, there's a lot of comments coming through. I'm just mindful again, for people who have screen readers, that those are being read. So Julie, do you have anything that you want to say to complete your story for those who can hang on?
Well, I just think that this is a really important category that covers all of the parts of the systems that aren't working.
Yeah.
And
Thank you.
Yeah.
Thank you, Julie. That is helpful because that is what we were hoping to clarify through that, through this discussion. And I see that there is comments in the chat also related to the safety net and why it might be a helpful exception. So that will be great to bring back to rediscuss and figure out how to define that further and what makes the
Thank
most
you.
sense.
My guess is we'll have to revisit this because there's so much interest, which is great. I do want to assure everybody that any of your comments in the chat will be captured and brought forward. The team looks at that when they debrief the notes, and we'll bring that forward to future meeting planning. So please keep your comments coming. These will be brought forward. If you have others you didn't share, please send them to the email so that we can consider them all together. And can we go to our next slide? These are some other additional comments, right?
Yeah,
These two will
I'll
also be moved
quickly.
forward.
Yes, you can just kind of, this was just, these are in the parking lot. I just wanted to note that we did read through the entire surveys. There was a lot of good comments. Some of these comments were things that have to be talked about, you know, at later dates. So we just were giving you some reference of things that people brought forward and that we have notes on and plan to use.
Thanks. And
Thank you.
Next slide. Thanks. So keep those other questions and comments coming. They will be brought forward as we said. And then next slide, please. Just to remind people, normally the group, oh, you can go to the next slide, sorry. Normally the group sends out a survey after this meeting. This month's survey might be a bit later than usual because of the July 4th holiday coming. So look for it, but it might take a few days. And also look for some questions in there about August meeting. People have been asking questions, and although the team have planned meeting topics, if there are a plethora of questions like we're seeing today, they do take this into account. And so if we go to the last slide, August's meeting is time for taking all this into account and doing a new level setting. So that's not the topic that was previously discussed, but based on your feedback and your requests, they're going to use the August date to look at how much work the group has done, where you are today in your knowledge and understanding, and then looking at the work ahead so you can start afresh in October. So there's slight change in terms of what August's planned meeting topic is, but hopefully this will accommodate those who have been asking for that and providing requests and input. We can go to the final slide to say thank you to everyone very much today for your conversation. We have made notes, and I just want to point out that for Rosalie, Julie, Trisha, and Bud, who said they wanted to come together on a discussion around cost data, we'll be sure to take that topic forward, as all your other questions that have been submitted. So thank you very much. Enjoy your 4th of July holiday. Stay cool, and we'll see you in August.
Didn't you say someone was gonna stay on after the others left? Huh?
Sorry,
I
Abdallah?
some the people, those elected to stick around after the others left.
No, some people wanted to have a discussion on a particular topic, and I've made notes of their names so we know who's interested when the time comes for that. But no, the meeting has ended now. Thank you very much for your participation. We appreciate it.
Oh, I thought I heard an invitation, but you
No,
know.
I said I've noted those people who want to have a separate discussion. So there's been
Okay.
no time set for that. Thank you, though.
Put my name on
Have a
that.
good day.
Put my name on that list, and if I